committee meets this morning to discuss two key nominations for important roles dealing with economic and health policy. First up, Dr. Rebecca Haffajee is nominated to serve as Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services. This job is at the center of the department's efforts to tackle the biggest health and family policy challenges and strategy, coordination, and research on health issues. For example, one of the big challenges is also a top priority for us at the committee. It involves improving mental health care in America. The lack of affordable mental health care is an issue in every community, in every state, the biggest cities and the smallest towns. It affects people of all backgrounds and all income levels. And Senator Crapo and I have put in vast amounts of time on this issue. We want this to be a bipartisan question because solving the mental health challenge requires lawmakers and the department to bring together the best ideas, no matter where they come from different federal agencies, from the state and local governments, from the private sector, from Democrats and Republicans here in the Congress. It's a big help to that process when there's a confirmed Assistant Secretary for Planning and Evaluation. It will also be a big help that Dr. Haffajee is very qualified for the job, and she brings, in my view, just the right experience for this position. In March 2021, she was appointed Principal Deputy Assistant Secretary for Planning and Evaluation. She served as the acting Assistant Secretary for more than a year. She's a top expert in a widely published research on health policy issues. So she is going to help us lead progress on improving mental health, as well as fighting the drug abuse epidemic, improving health coverage, and lowering the cost of prescription medicine. Next up, Dr. Shambaugh is nominated to serve as Undersecretary for International Affairs at the Department. The Treasury's Office of International Affairs deals with major global economic challenges, including cracking down on currency manipulation, dealing with trade cheats, and strengthening America's relationship with economic allies. That includes coordination and evaluating the effectiveness of sanctions on Russia. It comes down to protecting and growing our economy and creating jobs. And in my view, I think Mr. Shambaugh knows this, Dr. Shambaugh, that this speaks to the whole question of giving everybody in America, everybody, the chance to get ahead. The doctor is a professor of economics and international affairs at the George Washington University. He previously served as a member of the White House Council on Economic Advisors and on the Council of Economic Affairs staff as chief economist. He's also an author and an expert on international economics. Colleagues, I will just tell you, my view is we have two highly qualified nominees here. I want to thank them for joining the committee today, for their willingness to serve, and I want to recognize my friend, Senator Crapo.
Thank you, Chairman Wyden. And welcome Dr. Shambaugh and Dr. Haffajee, and congratulations on your nominations. Dr. Shambaugh, in terms of tax issues, the OECD negotiations could have significant international economic consequences, and this important position could be involved in advising on the economic effects of the OECD agreement and projected implementation. I hope you'll share your insights on the effect of the OECD agreement on U.S. businesses and U.S. revenue, and any other analysis of the potential effects of the OECD agreement. Additionally, I look forward to hearing your perspectives on the current international economic environment, including the interplay between fiscal policy, energy policy, and the 40-year high inflation which is affecting America today. Turning to Dr. Haffajee, you have written extensively on the health impacts of marijuana legalization, opioid addiction treatment, and public health emergencies, among other issues. Please share your perspectives on these issues, as well as how, should you be confirmed, you will challenge the administration to evaluate programs in these and other areas fairly and with close attention to what the facts indicate rather than what political agendas might dictate. I remind both of our nominees also that the success of the Departments of Treasury and Health and Human Services depends on a strong partnership with Congress, which includes transparency and consultation with our offices. This is true not just because of the authority Congress has delegated, but because members are well positioned to understand the needs of our constituents. I ask both nominees today to confirm that they will be attentive to the members of this committee and indeed the broader Senate, should they be confirmed. and I look forward to hearing your testimony and your responses to questions. Thank you.
I thank my colleague. Dr. Shambaugh will have your opener and Dr. Haffagee's opener. Then we have some questions, procedural questions we've got to deal with, and we'll have questions for members. Dr. Shambaugh, please.
Thank you. Chairman Wyden, Ranking Member Crapo, and distinguished members of the committee, I'm honored to appear before the committee today as you consider my nomination to be Treasury Undersecretary of International Affairs. I'm thankful for the support of President Biden, Vice President Harris, and Secretary Yellen. If confirmed, it would be a privilege to work with the distinguished public servants in international affairs at Treasury. I look forward to working closely with this committee and your colleagues in Congress to pursue international economic policies that further the interests of the American people. I want to thank my family for their support, my wife Lisa, who is here with me, my children Tyler and Jack, my sister, and my parents Kurt and Nancy Shambaugh. My mother was a teacher. She volunteered at the local hospital and in schools, and she eventually became president of the school board in the local public school system I attended. My father worked in finance and also served as a trustee for our church. I learned from my parents that public service and making a positive contribution in the world was an important responsibility. I've tried to carry this lesson with me, serving as a deacon in 2 churches and coaching youth sports. I've also dedicated much of my professional life to trying to make a positive contribution in the world through public service and engaging in public policy. For the last 25 years, my career has been focused on economic policy. My core area of research has been empirical international macroeconomics, the study of exchange rates, capital flows, spillovers across countries. I've published articles in top journals as well as a book on these questions. I'm a research associate at the National Bureau of Economic Research in international finance and macroeconomics. I've also presented at major conferences in central banks around the world, spent time as a visitor at the IMF, and have taught international economics for over 20 years. I believe my experience creates a strong foundation to address many of the policy questions faced by Treasury's Office of International Affairs. At the same time, my experience is not just theoretical. During my time at the White House Council of Economic Advisors, I attended many strategic and economic dialogue meetings with China, and met with Chinese officials and officials from a number of countries around the world. I also represented the U.S. government at the OECD in discussions related to economic issues. These experiences have prepared me well to serve in the role of Undersecretary, where international economic diplomacy is one of the many responsibilities. I also had the opportunity to work on a wide range of international economic issues, ranging from trade and development economics to international finance and climate, preparing me for the broad range of subjects covered by Treasury International Affairs. I also have significant experience working on U.S. economic policy issues, ranging from economic and wage growth to energy and climate issues to regional disparities and the impact of trade shocks. Studying these issues has prepared me to carefully consider how U.S. global economic leadership on a range of issues affects the American economy, American households, and American workers. The last 2 decades have emphasized more than ever the importance of our global economic policies and how those policies affect the U.S. economy, our national security, and American families. Shifting trade patterns and rising trade competition with China has directly impacted many communities around the United States. The global economic crisis after 2008 accentuated the importance of global growth for the health of our economy. Dealing with the disruption of the flow of goods and parts during the pandemic has highlighted the interconnectedness of our economy. Most recently, U.S. global economic tools are being used to respond to the illegal invasion of Ukraine by Russia, which further underscores the importance of our economic diplomacy to protect national security. Interconnectedness, financial crises, shocks from trade, complicated supply chains, unequal global outcomes, the links between foreign and economic policies. These are the challenges of our time. If confirmed, I look forward to working on these issues and consulting closely with the members of this committee and Congress. Thank you, Chairman Wyden, Ranking Member Crapo. I look forward to your questions.
Dr. Shambaugh, thank you. Dr. Haffajee.
Chairman Wyden, Ranking Member Crapo, and members of the committee, thank you for considering my nomination to be the Assistant Secretary for Planning and Evaluation, or the ASPE, within the U.S. Department of Health and Human Services. I am honored by President Biden's decision to nominate me for this role, and should I be confirmed, I look forward to serving under his leadership and Secretary Becerra's leadership. Before I begin my testimony, I would like to thank my family. With me here today is my husband, James Drabick, and supporting me virtually are my 2 young children, Annabelle and Samuel, as well as my father and sister, Drs. Charles and Jessica Haffajee. With me in spirit is my mother, Dr. Ann Haffajee. Without their support and their love, I would not be here today. My name is Rebecca Haffajee. I am a lawyer, researcher, and policy analyst, and before all of those things, I am a daughter. Both of my parents were first-generation Americans, and both were clinicians. Growing up and watching them work in healthcare inspired my passion for improving the health and well-being of our populations, all Americans. My father is still a practicing cardiologist. He loves his patients, and his patients love him. And watching him be the best physician he can be and often saving their lives taught me how critical patient-centered care is to positive health outcomes. My mother was a renowned dental researcher. She is also my biggest inspiration. My mother not only lovingly raised a family and excelled in her career, but she did so while battling long-term cancer throughout much of her life. Her battle taught me how important it is to ensure that we're doing the best thing for people when they're experiencing serious health challenges. Though I began my professional career in healthcare law, my passion really lies in using research and the research process to implement policy changes that improve people's health and well-being. I've spent time living in East Africa, working in public health on research around care for mothers and children affected by HIV/AIDS. For more than a decade, I have focused on U.S. health policy research, first as a professor at the University of Michigan, and then as a policy researcher at the RAND Corporation. I'm passionate about my work because I truly believe that changes made at the federal, state, and local levels can have meaningful impacts when research informs that policy. While many in government and across the country may not be familiar with ASPE, its work changes lives. Researchers at ASPE work to ensure that the President, the Secretary, and leaders across HHS have the best available data and evidence when they are making decisions and measuring the impact of those decisions on the population's health and well-being. For more than a year now, I have worked within ASPE, serving as the Acting Assistant Secretary. I've had the opportunity to lead much of the agency's most rigorous research and strategic planning, and my understanding of the nuts and bolts of the agency, as well as the department and administration at large, and the strong relationships I've built, will serve me well in the role should I be confirmed. If confirmed as the Assistant Secretary for Planning and Evaluation, I would work to ensure that ASPE is focused on using the best research and data to expand healthcare access, strengthen behavioral health, and advance equity. We know from our work in ASPE that expanding access to healthcare is critical to our nation's health and well-being. When people don't have healthcare coverage or that coverage is not high quality, we all suffer the consequences. Mental health and substance use challenges have been exacerbated by COVID-19. But even before the pandemic, this area of health was underemphasized and underfunded. ASPE can play a critical role in strengthening our nation's behavioral health infrastructure and has demonstrated this already through its work on the HHS overdose prevention strategy, which I was privileged to lead in developing. Finally, on equity, to understand why health inequities exist and how to best address them, we have to look at the root causes, also known as the social determinants of health. Things like income, education, housing, social supports. These are so important to health outcomes. And through ASPE's ongoing social determinants of health and equity work, we can understand how best to ensure that those in underserved and under-resourced populations don't experience gaps in services and supports and are able to live their healthiest lives. None of these priorities I have laid out can be achieved without strong partnership and communication, particularly with the Congress and with stakeholders across the healthcare sector. I've learned in my various roles the importance of listening to and understanding the perspectives of different health stakeholders, including patients, providers, and governments. These perspectives inform research agendas, the data collected and analyzed, and ultimately effective policies. The research that ASPE provides is critical to the work of HHS and agencies across the federal government. If confirmed, I look forward to continuing ASPE's transformative work to meet the health and well-being needs of our nation. Thank you for considering my nomination, and I look forward to your questions.
Dr. Haffajee, thank you. Now, I have some obligatory questions I have to ask both of you. First, is there anything that you're aware of in your background that might represent a conflict of interest with the duties of the office to which you have been nominated?
No.
No.
Second, do you know of any reason, personal or otherwise, that would in any way prevent you from fully and honorably discharging the responsibilities of the office to which you've been nominated?
No.
Third, do you agree without reservation to respond to any reasonable summons to appear and testify before any duly constituted committee of the Congress if you're confirmed?
Yes.
Yes.
Finally, do you commit to providing a prompt response in writing to any questions addressed to you by any senator of the committee?
Yes.
Yes.
All right. Let's go to questions and begin with you, Dr. Shambaugh. If you're confirmed, you are going to be involved in the debate about global taxation. And I recently released an analysis of my current investigation into how major pharmaceutical companies are using tax havens to avoid paying their fair share of taxes. Our report showed that AbbVie had 75% of its sales in the United States, but 99% of its profits were reported offshore, much of it in tax havens like Bermuda. The report also found that since 2017, AbbVie has been able to exploit subsidiaries in offshore tax havens to avoid paying billions of dollars in taxes on prescription drug sales. So let's picture it this morning. You have got Americans waiting in line to get their prescriptions filled, wondering how they're going to be able to afford their medicines and still pay the rent and buy groceries. And then we see these big pharmaceutical giants. And by the way, we're concerned about Merck and Abbott as well because they've been stonewalling our questions. So we've got these big pharmaceutical giants finding ways to make money here in the United States, selling medicines, desperately needed medicines to the senior citizens, and then they go off and book their profits somewhere else. It's, textbook tax evasion. Now, you're not at the Treasury Department now, but what is your understanding of how reforming our international tax system in line with a global minimum tax would address this type of tax avoidance?
Well, Senator, I think, first of all, by having a global minimum tax from the United States, what it would mean is income that is booked outside the United States would still be facing some sort of tax. It can right now under the 2017 law, but as your investigation suggests, it's still something that firms can avoid. The global minimum tax that's been negotiated, my understanding is, would also raise that rate somewhat from the 2017 law, which would bring it a little closer to the U.S. statutory rate, which would basically give firms less of an incentive to book profits elsewhere. I think a really crucial part of it, though, my understanding of it is because it is negotiated with over 100 countries, it means that other countries would also have a global minimum tax set up so that U.S. firms wouldn't face a disadvantage because the U.S. taxes foreign profits because other countries would be doing so as well. So it I think in that sense would try to harmonize policies across the world and have less of a race to the bottom setup, and frankly, really less of an incentive to use tax havens.
Well, I thank you, and that's a thoughtful answer, and I'm not surprised because you've worked on these global economic issues for some time. People always say, oh, this stuff is really complicated, hard to sort out. Not so complicated when you think, Senator Bennett, about senior citizens standing in line in Colorado, trying to figure out how they're going to afford their medicine, and then we read about these companies that make their profits in the United States hunting and pecking for tax havens around the country to avoid paying their fair share. So I thank you for your thoughtful answer. Dr. Haffajee, thank you as well for being here and for the professionalism that you have brought to this whole health issue for years in the past. I want to ask you about the accelerated FDA approval issue and put it in the context of Alzheimer's, because we all desperately want cures for Alzheimer's. My mother, who got a master's degree from Yale in the days when no woman got a master's degree, was dealing with Alzheimer's for well over a decade. So we desperately want a cure. So we recently went through the accelerated approval process with respect to a new Alzheimer's drug, and I want to walk you through what happened. The company comes in, we've got what amounts to a real breakthrough, a cure. So what's the government going to do? The government is going to jack up Part B premiums on seniors in order to cover this. Well, it's still questionable what the evidence is. So when Dr. Califf was nominated to head the FDA, I asked him in considerable detail about whether we ought to have a fresh policy. I want to support accelerated approvals for desperately needed medicine, but I also want the next step to be those critical trials to make sure we get to the bottom of the evidence. Do you agree with Dr. Califf? And what might you do in your position at ASPE, the HHS department, to promote that philosophy? Because I feel very strongly about it. Accelerated approvals can really give us the opportunity to make breakthroughs. But we also got to have the next step, which are these critical trials. Your thoughts?
Thank you, Senator Wyden, for the question, and this is an important one. First off, I do agree with Dr. Califf's position that we need to make sure that when we have drugs approved through this accelerated pathway, that we do the confirmatory studies and confirm the clinical benefits. And I would, were I to be confirmed, I would support you and Dr. Califf in making sure that that happens.
Very good. Senator Crapo.
Thank you, Senator Wyden. And Dr. Shambaugh, the state and local funds that were eventually adopted in the American Recovery Plan Act, or ARPA, totaled $350 billion, even though many commentators criticized that amount as excessive. Indeed, many states reported budget surpluses over the last 2 years, with California reporting a $76 billion surplus in 2021 and a $98 billion surplus in 2022. And also in 2021, California received $26 billion in federal aid under ARPA. In light of these circumstances, were the critics of the ARPA plan correct in calling the $350 billion state aid package excessive?
Senator, it's not an issue I've spent a great deal of time looking at. So from the surface, what I would say is one of the challenges in crafting some sort of bill like that is always you don't know exactly what's coming down the pike. And so the recovery was more rapid, I think, than many people expected. And so in that sense, state budgets have recovered faster than I think many people were anticipating at the time it was passed.
Well, thank you. I actually think that that's accurate, and there are many of us who are saying maybe we should redirect those funds either back to the Treasury or something else, but I won't go into that with you. Did the $1.9 trillion of federal spending in ARPA that was unleashed through both state and local aid as well as through direct payments to individuals, did that contribute to our inflation over the past 2 years?
I think inflation is generally seen by most economists to be a function of supply and demand in the economy. To the extent that the Recovery Act led to, or the Rescue Act led to, faster economic growth than we would have had, fewer people unemployed, people with more money in their bank accounts, that will provide some more demand. I think most studies have said it's somewhat at the margin, not a massive impact, but that it probably left us with less unemployment than we would have had and therefore a little more demand in the economy.
Well, just finally on this issue, California has a new, what I call a scheme to send residents an additional $17 billion in, quote, inflation relief, end quote, checks, which a Bloomberg columnist recently called economic illiteracy of the highest order, that will increase. And I think what he was saying is that that's just going to fuel inflation. Would you agree that sending out a $17 billion worth of checks to people in order to help them deal with inflation is actually going to cause a greater inflationary impact?
I think the reality is, given the size of the economy, $17 billion probably would have a marginal impact. It probably wouldn't be all that substantial. I think any more money you spend, probably at the very small margin, could increase inflation. But I don't think $17 billion in the scope of the U.S. economy would probably be a substantial factor.
Well, would you at least agree that pumping spending into the economy at this point, when we have a demand issue with regard to inflation, is going to cause more demand and more inflation?
Yes, that's what I'm saying. I agree. At the margin, more demand is going to lead possibly to more inflation. I think things around that margin probably wouldn't be a huge impact.
Okay, thank you. And Dr. Haffajee, in 2014, I want to talk to you about the public health emergency surrounding COVID. In 2014, you and two co-authors wrote that the spirit of emergency powers laws seems to enshrine three key criteria for suspending normal lawmaking processes. The situation is exigent, the anticipated or potential harm would be calamitous, and the harm cannot be avoided through ordinary procedures. That's what we saw with COVID. The lack of clear triggering thresholds for terminating emergency powers is particularly troubling. This is again from your article, creating the possibility that critical legal protections might be suspended indefinitely. So the question I have to you, which is one that's being asked by many, is, are we still in a public health emergency related to COVID-19?
Thank you for the question, Senator Crapo. During COVID-19, we have found that the public health emergency declaration by the Secretary has unleashed a number of authorities that have been very helpful to addressing the acute harms of the pandemic. And many of those flexibilities, there's exploration about should they be extended, for example, telehealth. So ultimately, the decision about whether to terminate the public health emergency rests with the Secretary. ASPE's role, and would continue to be, were I to be confirmed, is to inform that with data and evidence around what is the situation on the ground, what would need to happen, should this public health emergency be terminated. It is a complex issue because it involves agencies across HHS and partnership with the states, which is why the Secretary has said he would give 60 days notice before terminating.
Well, thank you for that analysis. Senator Wyden and I are working on the lessons to learn from some of these emergency actions that have been very helpful and maybe should become permanent. Mm-hmm. I think that should happen in regular order, though. Thank you.
Thank you, Senator Crapo, and we will be working together on those issues. Senator Bennett.
Thank you, Mr. Chairman. Thank you for holding the hearing, and thank you both for your willingness to serve. Dr. Shambaugh, I'm concerned that for years across Democratic and Republican administrations, we've neglected to implement a coherent strategy in the Indo-Pacific region, and instead China has expanded its global influence, including across Latin America. For example, businesses in Colorado and throughout the country are experiencing supply chain challenges driven in part by our over-reliance on China. In light of supply chain disruptions due to the COVID crisis and ongoing global instability, how can we use our trade and development policy to reshore critical supply chains in the United States and nearshore others? Can this strategy strengthen our relationship with countries across our hemisphere?
Thank you, Senator. I would say the shortest answer is that yes, policies aimed at reshoring or friendshoring, as I know Secretary Yellen has referred to it, or nearshoring, it presents opportunities to try to strengthen our supply chains. I think some of that we've seen. I think firms are learning on their own that firms that tried to minimize costs and had only one supplier as the lowest cost supplier are suddenly finding that may be the lowest cost in good times, but not in bad times. And so they're trying to diversify their supply chains on their own. But I think it's certainly the kind of thing that a coherent set of policies aimed to work with allies, both across the Indo-Pacific and in the Western Hemisphere, can be important as ways to try to make sure that we have critical supply chains that are durable and lasting even in bad times.
What kind of tools are available to you or the administration, including things like development banks to try to improve the supply chains, here and in Latin America as well?
Certainly when it comes to Western Hemisphere, the multilateral development banks become an important partner for the United States to try to make sure that private industry is developing and has access to capital in the region. That's an important goal. Certainly across the Indo-Pacific, the new framework that the administration has rolled out to try to coordinate better with other countries to make sure, whether it's around rules, whether it's around sourcing, whether it's around data transparency, that as many things as we can do to make sure firms understand a coherent set of rules makes it much easier for them to transact across countries.
Thanks. Dr. Haffajee, during your time as Acting Assistant Secretary for Planning and Evaluation, The office published a report on the effect of the expanded advanced premium tax credit on health insurance coverage. This support has reduced premium costs for over 100,000 Coloradans to enroll in affordable health insurance plans for the first time, but it's set to expire at the end of the year if Congress fails to act. In Colorado, if we fail to extend this support, people with the lowest income could see their premiums increase 2,500% per month. That's 2.5% per month. That's an unacceptable outcome. When tax cuts for the rich are about to expire, Congress has bent over backwards to find funding to extend them. I think we need to do everything we can to extend the premium support. Could you discuss how ending the expanded premium tax credits will affect low and moderate income Americans, and what other kinds of research and evaluation do you intend to focus on should you be confirmed?
Thank you for the question, Senator Bennett. Really here, the HHS and ASPE are committed to expanding access and affordability of coverage to as many Americans as possible. The advanced premium tax credits have been a really important tool from the ACA, but also, as you note, during the pandemic, through the ARP, the increased generosity of those has really made coverage more affordable for more people and covered millions of uninsured that otherwise wouldn't have been covered. You are correct. ASPE has done some analyses to look at what would happen should these go away in 2023. Approximates about 15% of the population on those plans would lose coverage across the country. So this is a really important issue to be thinking about as we move towards the end of this year. ASPE, and were I to be confirmed, would continue to conduct data analysis, support this Congress and this body in understanding what those implications would be.
Thank you both for your testimony. Thank you, Mr. Chairman.
Thank you, Senator Bennett. Senator Casey.
Mr. Chairman, thanks very much. I want to thank both witnesses today, and especially for your commitment to public service, both Professor Shambaugh and Dr. Haffajee. I wanted to start, Doctor, with you to commend the research work that you've done, the public policy work you've done. I wanted to ask you a question that focuses on home and community-based services for seniors and people with disabilities, which is a real failing. The lack of investment in this priority is a real failing of the federal government over a long period of time. The only way you can get those services in America today is if you're the beneficiary of a waiver, and the waiting list for those waivers is approaching 1 million people. We should invest in the expansion of home and community-based services if we're going to call ourselves the greatest country in the world and the country that claims to provide the best care to our people. But we haven't gotten there yet, and we've got a battle ahead to get there. I wanted to ask you, though, in particular about the fact that if we make this investment, it'll not only be better for seniors to get care in their home and people with disabilities to get care in their home or in the community, and there's an extraordinarily high preference for that, but it's also cost-effective. It's better for the federal government if we do this. So could you talk about the research that you could do if you were confirmed as the Assistant Secretary for Planning and Evaluation to assess savings to the Medicare program if we were to increase access to these home and community-based services?
Thank you for the question, Senator Casey. And as you note, home and community-based care services are so important, are becoming more and more, we have done a lot to shift the balance towards those, but have more work to do and are becoming more and more important as we have an aging population, as we have more chronic conditions, as people really want to receive care and services in their homes as much as possible. I can attest to that, having had a mother who had a chronic health condition and saw her preference for that strongly. I think the principles that we need to make sure that those services are high quality and meet the needs of our beneficiaries, and then also that the workforce is expanded and it works in safe conditions, is reimbursed. Those are some of the, I think, top priorities there. Another important issue, as you note, is these can be cost effective, both within the Medicaid program, where states are trying to expand their dollars as much as possible and put them towards the most effective services, but also potentially in the Medicare program as well. To my understanding, there hasn't been a lot of research so far on that interaction between the Medicaid and Medicare populations. If I were to be confirmed, I would be happy to have further conversations and think about the ways that ASPE could look at that issue.
Well, thank you. And I'm grateful you mentioned the workforce, because that's another part of the problem. If you're going to say you have the best care in the world and you're paying people on average $12 an hour, that's not the best care in the world. And that's why there's such a high turnover and a real workforce crisis. Professor, I wanted to ask you about labor market recovery. What's your view of the most important steps we could take to ensure that we complete our labor market recovery?
Well, Senator, I would say in some ways many of those issues would probably rest to my left. Right? I think the continuing complications coming from the pandemic continue to keep, not necessarily for, say, what we'll call prime age workers between 25 and 54, but workers that are a little bit older than that. Many of them, it seems, still haven't re-entered the labor force. Some of that does seem to be either because they're caring for people due to the pandemic or concerned about the pandemic themselves. That's one concern I would say that we've definitely seen. I would say in general, robust growth in the economy is often the best tonic for the labor market, and so continuing a strong economy is the best way to get people to work generally.
Thanks very much. Thank you, Mr. Chairman.
Thank my colleague, Dr. Haffajee. I just want to build for a quick second on what Senator Casey was talking about with respect to elder care and care at home. One of the things that I look at, and I've been at this since the days when I was director of the Oregon Gray Panthers, years and years ago, is what are the principles that we ought to be looking at for the future? For example, I think healthcare prevention would obviously be one, and it's in your bailiwick. But Senator Casey has been prosecuting this case so well and so relentlessly on another area that ought to be a foundation of American healthcare, and that's more care at home. And as he noted, and I remember watching him work at Gerontology Association, was supportive of the work that Senator Casey's doing, to be able to give people more care where they want it at home at less cost. That's about as good as it gets in terms of public policy. So I really look forward to working with you as you follow up on Senator Casey's work with respect to elder care. Because if you look at two of the key crucial health pinnacles for the future, one of them is prevention and the other is taking care of people at home. And by the way, what we found in this committee is there's huge interest in America's technology sector because they too know that there's an opportunity to get more services that are compassionate and cost-effective. So we want to work with you as you follow up with Senator Casey. Thank you. I thank my colleague, Senator Langford.
Thank you, Mr. Chairman. Dr. Shambaugh, I want to ask you a little bit about the Committee on Foreign Investment in the United States. You would oversee that. Obviously, there's an area that's left out currently in oversight, and that's agriculture. The Department of Agriculture is not sitting at the table, not helping make some of those decisions. There's a tremendous amount of investment that's coming from non-market economies to the United States in agriculture. I want to get your opinion on that, whether that needs to be included. That becomes a policy issue for us that we've got to be able to correct, but it's also a preference issue for you as well.
Thank you, Senator. I think security of food and our supply chains there and the way to make sure that we're getting food safely from farm to table in the United States is incredibly important. I think honestly, as to whether the Department of Agriculture should be part of CFIUS or not is a question for Congress. It's not something certainly I would want to to weigh in directly, I can say that I had the opportunity when I was on staff at the CEA to work at times on CFIUS. The professionals there are incredibly dedicated and take that job incredibly seriously, and I think would take the input that Congress thinks they should be taking.
Do you think that is a need at this point?
Without talking to the Assistant Secretary there or to the terrific staff there, it's a little hard for me to know to what extent they feel they can get what they need from the Department of Agriculture under the current setup by asking questions.
Right.
When it comes to the national security aspects, it was always, at least in my experience, the intelligence agencies and national security agencies would brief the rest of the committee as to whether a transaction was a risk. They may feel they can get that by just going and asking Department of Agriculture, or they may feel it would be helpful to have agriculture in the room. I can't speak to that.
Okay, we'll follow up on that in the days ahead. Be interested in your strategy and trying to be able to coordinate with the executive directors of IMF, World Bank, the IDB, trying to be able to get a more consistent policy set and to be able to make sure it's consistent with our national foreign policy. And obviously, I want to deal with some of the issues of China and how they're trying to affect some of those entities as well and what they're doing. What's your perspective on that?
I would say, as I think this administration has often spoken, we are in many ways in a competition with China. And I don't think that's strictly an economic competition around given sectors. I think it's also a competition for a different vision of how the global economy should be organized. And I think a large part of that for the United States is effectively using the international financial institutions and the multilateral development banks, because we see a world where institutions and the rule of law and transparency and accountability are important. And to me, those are institutions we should use very effectively. If I were confirmed to this position, I would take very seriously my engagement with the executive directors and try to make sure that we are always carrying out presenting a good alternate option to engaging with China for countries, whether it's in loans or other sorts of engagement, to make sure that that example always sat there of high standards, accountability, transparency, and really holding to our values in our economic diplomacy.
Yeah, with the World Bank, obviously China has graduated under their standards from being a developing country, yet they are still listed as a developing country. That time period wanes in about 3 more years at this point, and then they're going to ask for a renewal without question on that. Is that something that should be renewed for China as a developing country under World Bank standards?
My understanding, Senator, is you're absolutely correct that based on income levels, China has graduated past the normal view of a loan-eligible country. I know it is a complicated process when countries graduate. It doesn't happen kind of strictly based on the income cutoff. My understanding is back in 2018, the World Bank stated that they would start moving in this direction. It's something that I would spend a lot of time on because I think it's an important issue.
It is an important issue, and China doesn't need to stay as a developing country. Special drawing rights and that kind of authority being given to country, do you think that the special drawing rights given to country should be given to them so then they could then pay back Belt and Road Initiative loans back to China?
I think we would want to make sure that any funds that are going to poorer or emerging market countries are not being used to simply rechannel them towards China, and so that's something we would pay attention to.
I would agree on that. So that's one we need to be able to engage in. This tax conversation that's happening, you had used the term less of a race to the bottom earlier on tax policy. My concern is twofold. One is other countries seem to be more informed of what's happening in the negotiation than Congress is, and Congress is going to have to speak on this. We get to read about the negotiations. Other countries actually get to participate in it. I think that's a problem, and that needs to be corrected with just consultation and information, not after the fact. The second part of this is this race to the bottom on the tax piece on it has a huge gap in it that is not just the tax rate on it, but it's also other countries that subsidize are excluded from that. So it's not really a race to the bottom on tax policy, it's a race to the bottom on subsidies. So there's a very large problem in all of this negotiation that seems to be left out in this. I'm trying to figure out where this is going to go, and if you agree with this, that basically the current policy that we have in the United States on credits, other countries get to just not count their subsidies, but our credits are. So you're talking about trying to change American tax policy to match more of Europe's tax policy when they get a chance to waive it. Is that a problem? Because it looks like a very different race to the bottom that's happening.
Senator, I would say that I'm not in the building yet, and so obviously I was not part of the negotiation, so I also don't know a great deal about some of the specifics yet. In terms of the question of subsidies versus different types of credits, all I would say is that, if I were confirmed, I would certainly intend to consult with and engage with Congress carefully on the issue to make sure that any agreement that is being struck or any details that are being finalized are being done in a way that makes sense with other policies Congress has in mind.
Well, just keeping Congress engaged in that would be helpful. Thank you.
I thank my colleague, and I just want him to know that I look forward to working with him on this whole issue of global taxation. Clearly, what we're looking for is a way to ensure that we're competitive in these tough global markets so that we promote job creation. And as you heard me to say, what I'm particularly concerned about is tax avoidance, because we have seen, particularly with AbbVie, and I'm concerned about the possibility of Merck and Abbott doing exactly the same thing, some really flagrant cases. So I appreciate my colleague being interested in this whole area, and I look forward to working with him. My colleague, Senator Cortez Masto.
Thank you. Hello, welcome. Congratulations. Let me. Is it Haffajee? I want to pronounce that right, Doctor. Thank you. Thank you for your work with ASPE to date as acting secretary, assistant secretary as well. Let me talk a little bit about kids' mental health. I appreciate how much attention ASPE has paid to the mental health challenges that so many families are facing today. Every time I go home, I hear from Nevadans struggling to find services that will meet their needs or the needs of their loved ones. ASPE's work helps us to quantify those issues so that both the administration and Congress can move to address them. One report explores child and adolescent mental health during COVID-19 and provides considerations for schools and early childhood education providers. Can you talk a little bit about how ASPE works with other agencies, both at HHS and across the government, to share the findings from your work?
Thank you, Senator Cortez Masto, and that's a great question. And youth mental health has been so important for a long time, but also particularly during COVID-19, and is something I'm personally extremely invested in. I think it's really important for coordination within HHS and across the federal government on this issue. Many children, some of the issue is identifying mental health and making sure that services are available in the settings where they will receive them. And so things like making sure that services are available in schools and other settings where, and we're identifying risk factors early. So ASPE works intimately with the Administration for Children and Families, along with other sister agencies, to make sure that the studies that ASPE does are important to questions that they want answered, and then that ASPE makes sure that those results are available both within government and to bodies like this committee. And I would commit to doing so as much as possible were it to be confirmed.
Thank you. I would hope so, because clearly there's, for me, this idea of bringing essential resources into my community requires the federal agencies, everybody to work together and coordinate and get outside of their silos.
Yep.
Quite honestly, and just make sure we're focused, particularly when it comes to our children's mental health, but in general, behavioral health and mental health services. Let me follow up on that, because I know this coming Saturday, which July 16th, marks the launch of 988, the National Suicide Prevention Lifeline. For the first time, we know that assistance for those in mental health crisis will be just the 3 digits away. Here's my biggest concern. I think it's great we have that hotline, and we are working to make sure we have people to staff it. But if we don't have services for them to be referred to, we're going to be doing a lot of disservice to so many in need. So I know that more needs to be done to connect callers to services for acute and ongoing needs. I'm hoping that you can talk a little bit about the work ASPE has done thus far in this space, And are we prepared for it, or what we still need to do to address those essential services where there's a gap in services?
Yeah, thank you for the question and for your work, I know, on mobile crisis in the past and this committee's. 988 is so important in building on state systems to respond to mental health and substance use crisis and really create a federal infrastructure to work with states as well. I know SAMHSA has been working very, very hard to make sure that those services are ready and to bring to bear the resources that would be needed. I think the Safer Communities Act also extends those resources quite a bit. So all of those are very helpful. ASBE's role is really to inform, with data and evidence, what would be needed, and to help support SAMHSA in that. There are, my understanding, ongoing evaluations there, and would commit to, looking at that deeply and making sure that the implementation is rolled out as smoothly as possible, and that we're continuing to evaluate after what else is needed.
Right. Thank you. Thank you. Mr. Shambaugh, let me talk to you a little bit about 301 tariff exclusions. And again, also to you, congratulations. I have a company in my state, it's Haas Automotive Automation, and the company is expanding domestic production in Nevada, is one of the few domestic computer numerically controlled machine manufacturers remaining in the United States. And I think, like all of my colleagues, we all believe that maintaining a strong domestic source of these CNC machines is crucial for both the economy and domestic security. Haas requires an extraordinary amount of cast iron castings to make CNC machines, an amount that far exceeds what is domestically capable of being produced by U.S. foundries and non-Chinese sources. Therefore, China is currently the only source that can produce the necessary volume of quality castings. Because the imported castings are of Chinese origin, they are on list 3 of the Section 301 tariffs. And this company has been denied 6 different exclusion requests without explanation, but was able to use granted exclusions from other sources. And as of August 2020, those exclusions expired and all requests for extensions denied without explanation. I absolutely support the Senate USECOT's bill that would direct USTR to open a new exclusion process and follow certain transparency and accountability guidelines when considering petitions. If confirmed, you would have a role in international economic diplomacy, specifically trade and China's impact on our domestic supply chain. Haas is just one example of domestic manufacturing being impacted by China's stronghold on our supply chain. How do you plan to lead Treasury's engagement on trade negotiations, particularly in the areas of investment and supply chain?
Thank you, Senator. I would say with regards to the specific issue around 301 exclusions, that would certainly sit more with USTR, but around the broader issue of the 301 tariffs that are in place, I think that is one area where Secretary Yellen has talked about the fact that, these tariffs, many of them were put in place as a specific response to specific Chinese actions, and I think that's incredibly important to respond strongly to China where they take actions. Some of the tariffs, though, it seemed like were a bit more of a back and forth with China that maybe had less of a strategic orientation to them. And so I think looking carefully at which of these tariffs should be at what level is, as the economy has changed since they were put in place, is an important issue. I think more broadly, trying to make sure that we can do what we can to have sufficient sourcing for supply chains in not just partly in the United States, but also across a range of countries so that we are less vulnerable to shocks with regards to a particular country is a really important goal for us. To try to make sure our supply chains are more resilient in the face of shocks, I think would make us all much better off.
Thank you.
I thank my colleague, and as usual, my colleague really hits the key challenge on that last point on trade, because of course we want tough trade enforcement, but we also want market access. We want, for example, companies like yours to be able to get answers. So I thank my colleague, as usual, for hitting the key point. Next up is Senator Thune.
Thank you, Mr. Chairman. Welcome to both of you. It's good to have you here. Dr. Haffajee, congratulations on your nomination, and thanks for your service at HHS to date. I believe this was covered in your staff interview, but I want to be sure to bring it up on the record. As policymakers, we are evaluating long-term telehealth policies for when the public health emergency is over. It would be helpful for the agency to be able to provide Congress data on utilization trends, including by modality, such as audio-visual and audio-only, as is currently permitted now. Is this something that HHS could commit to doing if you're confirmed?
Thank you for the important question, Senator Thune. And, you know, telehealth has been so important during the pandemic. We've really learned so much already, but need to continue these evaluations as well. ASPE has done a fair amount of work on telehealth utilization across payers, across populations, and some by modality, as much as we can identify that, and shown you know, vast increases, but also some disparities that need to be addressed as well. And so, yes, I would commit to continuing to evaluate that, and I think the modality issue is very important, as you note.
Okay, thank you. When discussing the Supreme Court's decision to overturn Roe v. Wade, Secretary Becerra recently stated, and I quote, "If there's something that we can do, we will find it and we will do it at HHS," end quote. If confirmed, what role do you expect you might play in finding something that HHS can do?
Thank you for the question, Senator Thune. You know, HHS is committed with reproductive health services and also health and human services to, you know, meet the needs of beneficiaries, but also to follow the law. And I would commit to doing both. ASPE's role really is to support, if asked by the Secretary, any data and evidence on these issues.
So just to follow up that, if you wouldn't be directly involved in the response, you do anticipate that the office would be involved in future efforts to conduct research to support HHS's pro-abortion policy?
Thank you for the question. Again, if asked, this has not been a major area of ASPE's focus in the past, but if asked, looking into issues like access, you know, what the data actually says about that to inform decisions.
Dr. Shambaugh, on April 8th of last year, you wrote a piece for Brookings titled, and I quote, "Don't overreact to inflation data this spring," end quote. The average inflation rate in March of that year, when the American Rescue Plan became law, was 2.6%. The following month, the inflation rate was 4.2%. Since that time, the U.S. inflation has skyrocketed to 8.6%, which is a 40-year high. Food, gas, and shelter have contributed to some of the biggest price increases, and tomorrow's Consumer Price Index figures could be even higher. Behind these historically high inflation numbers are Americans who are experiencing real financial challenges, particularly the less fortunate among our society. My question is, do you expect U.S. inflation to continue to increase, and how long do you expect an elevated level of U.S. inflation to be the norm?
Thank you, Senator, for the question. I guess in terms of what do I expect from inflation, I'd say recent inflation that we've seen, say, in the last 6 months, a great deal of it has been a response to to Russia's invasion of Ukraine in terms of what we've seen in commodity markets in particular and energy markets. Those things seem to be priced in, so I think on average, many economists, at least every forecast I've seen, expects to see inflation to start to come down. The piece you referred to was actually talking about an issue that will be relevant here, which is that we typically measure inflation as the change over 12 months. And then we were worried about the fact that the 12 months ago would have been the peak of the pandemic, and so data was going to look very odd for a little bit. I think in terms of what we expect to see inflation going forward, the same issue will be there, which is there were spikes in energy and commodity prices at the start of the Russian invasion. Those will sit in the 12-month inflation data for a considerable amount of time still.
Well, let me just, because I think, with all due respect, South Dakotans, and I would imagine most Americans, have literally had it up to here with inflation. And I don't think they believe that the Biden administration is taking it seriously. And to your point, energy is a perfect example of that. The energy policy, I think there's a direct correlation between policy decisions made by the administration and what the American people are experiencing at the pump. And I would argue the same thing with respect to spending and taxing. And we're talking now about another spending and taxing proposal. To the degree that Congress has something to say about fiscal policy, it seems to me that's the absolute wrong prescription at a time if you're trying to get inflation under control. The $2 trillion spending last year, and I just mentioned the statistics went 2.6 to 4.2 to 8.6. It's clear that the supply and demand are out of equilibrium. And a lot of that has to do with energy and the shutdown of American energy production, and I think the spending and tax and spending and regulatory policies administration. So I just urge you to take it with the utmost seriousness, because I know the American people are, and it's affecting them in a very direct way and their pocketbooks on a daily basis. Thank you, Mr. Chairman.
Thank you, Senator Thune. Senator Daines.
Chairman, thank you. 2 weeks ago, the Supreme Court issued a landmark decision to return the power back to the people and their elected representatives to enact laws to protect life. Since that ruling, I've been disappointed by ongoing efforts by the left to promote abortion on demand. One of the most outrageous proposals has been to use federal lands to set up abortion clinics to circumvent state law. When asked about this recently, Secretary Becerra responded, and I quote, "Every option's on the table." I believe that our public land should be life-giving to Americans, not life-taking. Question for Dr. Haffajee: if confirmed, you'll be responsible for advising Secretary Becerra on policy development as well as strategic planning. Do you think the federal government should allow the building of an abortion clinic on federal lands?
Thank you for the question, Senator Daines. Here again, HHS is committed to providing health and human services to all populations, including reproductive health services. I think that may be a legal question, better left to OGC and other colleagues. Again, ASPE's role would be to support with data and evidence as asked.
But what's your view on that? I mean, you're going to play. I mean, you're going through this process because you're going to have, if confirmed, a very important role of advising and with Secretary Becerra. Do you think the federal government should allow the building of an abortion clinic on federal lands?
Well, I think to me, it again comes down to the data and evidence around both the law and the data and evidence around what is needed for different populations. So I'm not sure that my personal view would be as relevant there, and I really do defer back to what does the science say, what does the data and evidence say.
But what data and evidence would? So you're saying it's a possibility if the data and evidence suggested that should be done?
I think, understanding what localities and states are, what the laws are there, what those populations need, and then making sure that those services are available would be very important.
So you're open to the idea?
I would have to get back to you on that.
But you can get back to me now. Are you open to that idea? I mean, specifically, it's federal lands. I mean, how about a national park? Should that be an option on the table?
Yeah, I mean, ultimately, again, this is going to be the Secretary's decision.
Yeah, but you're going to play an important role there. I mean, you can't just say, I'm just following orders. You are being, if appointed and confirmed, you're going to be in a very important advisory capacity here. So your opinion really matters.
Yeah. Yeah, no, I appreciate the question and the importance of ASPE's role. I do think that, again, here I would look to the data, try to inform, what populations need to meet their health and well-being needs, and then leave it to the Secretary to make those decisions.
Okay, but you're open to the option, it sounds like. You're not saying no.
To be honest, I haven't looked deeply enough into that issue to have formed a strong opinion.
After President Biden signed an executive order this last Friday to promote abortion, he said yesterday that he is considering declaring a public health emergency on abortion access. Dr. Haffajee, you wrote an article in the New England Journal of Medicine titled, quote, "What is a public health emergency?" where you raised concerns about the overuse of emergency powers. You wrote, and I quote, "There is also an instrumental reason to be concerned about the overuse of emergency powers. If this crucial tool is too readily, public health officials may find themselves, if it's used too readily, public health officials may find themselves like the boy who cried wolf. Their warnings about emergencies may go unheeded. Moreover, the public may lose trust in health officials, which may result in a loss of political legitimacy as well as a backlash about public health laws more generally." Dr. Haffajee, do you hold those same views today?
Thank you for the question, Senator Daines. And yes, I do. I do believe that, as both a lawyer and a public health researcher, that we need to think about, when we're using powers, that they are needed.
So do you think it would be an abuse? Do you think it's an abuse of emergency authority for President Biden to declare a public health emergency on abortion?
Again, that would be up to the Secretary and the President to make those determinations.
But I'm asking you what you think of it. You wrote, very eloquently about your concerns of the use of emergency powers. So do you think it's an abuse of authority when he declared this a public health emergency?
I thank you for the question. I think, here again, I think thinking about, does it meet the criteria for a public health emergency? Is this an urgent public health need? And really, are these powers going to address any of the problems that are trying to be solved? And so, again, ASPE would help to inform it with data and evidence, but ultimately that would be a secretarial and presidential decision.
All right. Thanks, Mr. Chairman.
Thank you, Senator Daines. Senator Whitehouse.
Thank you, Chairman. Good to be back. Mr. Shambaugh, if I could ask you a couple of questions about the international corporate tax agreement that Secretary Yellen helped negotiate. First off, do you know what a race to the bottom is?
Yes, I do.
Describe what a race to the bottom is.
So with regards to corporate taxation,
Just generally, but
sure.
if you wish.
So in anything, the race to the bottom idea is that countries might feel a need to continually lower standards or tax rates to try to attract firms back and forth from one another, so that you wind up with very low corporate tax rates or very low labor standards or something like that.
And corporations can game that system because actually getting themselves into a particular tax jurisdiction doesn't require a whole lot more than just filing legal papers, correct?
That's right, and especially because they can book income in places without necessarily moving that much activity, depending on how they use transfer prices.
And the international corporate tax agreement that Secretary Yellen helped negotiate would stem the race to the bottom in international corporate tax rates, would it not?
It would. It would provide a global minimum tax so that firms would be paying taxes on income regardless of destination, regardless of if they've moved the profits to a different destination.
And if the destination country doesn't charge the tax, they still have to pay it, and it goes to the compliant countries, does it not?
That's right. There was what I think is somewhat creative policy choice to put in an untaxed profits rule that would allow countries that have put in place a global minimum tax to go after, in a sense, the revenue that countries that are not putting that policy in place. And so it's what what economists would call kind of a self-enforcing mechanism to try to get everyone else to join.
And the incentive to destination countries to cheat on the international corporate tax program is dissipated if the tax is going to be collected anyway. They're just not going to get it.
That's right. There's less of an incentive to have low tax rates for a country, and there's less of an incentive for a firm to try to move to a low tax destination.
And in terms of competitiveness, we hear the companies that would like to enjoy little, no, or negative taxation. doing a lot of complaining about actually having to pay taxes. And one of the arguments that these big multinationals make is that it would interfere with their competitiveness. I come from Rhode Island. We have a lot of small businesses in my state. And one of the things that I see is those small businesses are at a huge competitive disadvantage against big multinationals because those small businesses actually pay taxes. They don't have the size or the legal staff to go out and reincorporate themselves in foreign countries and go through all the machinations to hide from tax paying. So at the end of the day, the big multinational paying no taxes is competing with an American company that pays taxes, and it seems to me that that creates significant competitive disadvantage for smaller American businesses. Is that a sensible way to look at the competitiveness problem?
I think it is absolutely fair to say that firms that don't have overseas activities don't have the same options in terms of what they could do with taxes. I also think, again, going back to your point about it being a global minimum tax, other countries are now employing a global minimum tax themselves, then the argument that it is a disadvantage for U.S. firms if the United States employs one, that starts to fade because
particularly if the tax gets charged even in cheating or non-compliant countries and they just don't get the revenue, then it really is an across-the-board floor below which the race to the bottom has no real reason to go.
I believe that's correct.
Well, thank you. It's helpful to have you clarify that. Ms. Haffajee, I just wanted to offer a thought to you as we get going, because we're going to continue to talk about this, but I've been kind of a maven of delivery system reform, of trying to reduce the actual cost of providing care by getting away from fee-for-service and following what in the Obama era was called the triple aim and so forth. And it seems to me that HHS has sort of lost sight of that aim. It is no longer anything that anybody talks about very much. It's hard work trying to get people to pay attention to opportunities to proceed that way. And I'd just like your thoughts on the importance now, particularly as we look at Medicare costs and solvency, of following the triple aim.
Thank you for the question, Senator Whitehouse, and fully agree that addressing the costs and long-term continuation of our programs, Medicare and the solvency, as you note, is a top priority to make sure these programs are available for beneficiaries and as high quality as they can be. And so appreciate your work on ACOs and other delivery system reforms in the past, and look forward to working with you more on those ideas.
Thank you. And as the chairman knows, this work does not cut benefits for beneficiaries. This work actually very often expands benefits for them and meets them where they are and helps them live healthier lives. So it's a real win-win, and I appreciate the chairman's indulgence and also interest and support in this over many years.
You will have it, Senator Whitehouse. And just on your earlier point with respect to the global taxation issue, because we have been talking about this with Dr. Shambaugh over the course of the morning, your point, which hasn't been made yet, that American small businesses that pay their fair share of taxes are disadvantaged compared to, for example, what the staff found last week with respect to AbbVie, the giant drug company, where they basically make all their sales in the United States and they book their profits elsewhere. And that, of course, is why it's so important that we also get answers from Abbott and Merck, which they have been stonewalling our investigators, which raises a question in my mind whether they're up to the same sort of thing. But look forward very much to working with you, and thank you especially for making that point, because mine's a small business state. We are overwhelmingly small businesses, and you put it in focus about what it means for those American small businesses that pay their fair share. They are disadvantaged by this, and I thank you for it. Senator Warren.
Thank you, Mr. Chairman. American families are getting hammered by soaring prices while giant corporations are raking in huge profits. And one big reason for that is that corporate lobbyists have rigged our tax code to reward offshoring. Now, offshoring means fewer good jobs for American workers. It also means overseas supply chains that keep breaking on American consumers. Professor Shambaugh, if confirmed, you would be Treasury's top international official leading work on investment issues. So today I wanted to talk with you about how our tax code disincentivizes investments in U.S. manufacturing. And I'd like to talk about AbbVie, the company that the chairman just raised, a big pharma company known for jacking up drug prices and exploiting tax breaks for offshoring. Now, AbbVie has manufacturing in Ireland, where it pays just 12.5% of its profits in taxes. Now the U.S. has international minimum tax rules that are supposed to prevent the abuse of tax havens, topping up AbbVie's tax bill if it pays too little overseas. But giant loopholes in this minimum tax mean that AbbVie still gets a huge tax break for investing in Ireland instead of the U.S. Professor Shambaugh, do you agree that our tax code should level the playing field for U.S. manufacturing and incentivize investments in the U.S. rather than in tax havens?
I would agree that we would want our tax code to encourage investment and production in the United States.
Okay, so let's dive into that a bit more. I agree with you. But tax loopholes are rewarding AbbVie's offshoring of drug manufacturing to tax havens. But here's the part I want to focus on. It gets worse by including tax incentives to offshore to high-tax countries as well. So take Germany, where AbbVie also has a manufacturing facility, and the corporate tax rate is about 30%, much higher than the U.S. rate of 21%. You would think that would mean investing in the U.S. is more attractive than investing in Germany. But because our international minimum tax rules look at all foreign taxes in totality paid together, AbbVie can use high taxes in Germany to shield its low-tax Irish income. AbbVie would not get the same benefit for paying U.S. taxes, so it's actually incentivized to invest in high-tax Germany rather than investing here in the United States. So, Professor Shambaugh, when you think about our international investment policy, does it make sense to invest in rewarding investing in Germany over investing in the United States?
I think we as a country do better when companies are choosing their location based off the skills of the workers and productivity of the economy and not gaming tax rates.
All right. So, look, I agree with you on this. Our international tax rules are broken, and incentivizing companies like AbbVie to invest everywhere outside the United States, low tax, high tax, makes no sense at all. So, would it surprise you then that AbbVie has used these broken rules to slash its effective tax rate in half, and that it books 99% of its income overseas?
I guess in some sense it wouldn't surprise me based off some of the things I've heard the chairman say so far today, but it does not sound like the way we want our tax system to function.
So would you like to see changes in this system?
I think having a global tax system that would not encourage booking tax profits in tax havens would definitely be better for the country.
You know, I know you've done work on this, and I appreciate the work you've done. I also want to say how much I appreciate the work that Chairman Wyden has done on this long and consistently. You know, we just have to recognize that corporate lobbyists have rigged our tax code for big pharma, and that it is incentivizing offshoring when we need to be investing in good jobs and secure supply chains here at home. This is why Secretary Yellen has negotiated an historic minimum tax agreement, and why congressional Democrats are working to end big pharma's overseas tax breaks and to lower prescription drug prices. I know that corporate lobbyists are kicking and screaming because they like a situation where their companies don't have to pay taxes, and they like to be able to continue to raise their prices. But our job is to put American workers, American small businesses, American consumers first, and we need to reward investments here in America instead of everywhere else in the world. So thank you very much, both of you, for your work.
Thank you, Senator Warren. That last point in particular, it's really a question of whose side are you on? Are you on the side of the consumers and small businesses, or are you just going to say these big guys can continue to practice tax avoidance? I would also note, and I think my colleague knows a little bit about the roots of this, that Senator Brown and Senator Warner and I, working with virtually every member of our caucus, the Democratic caucus and the Finance Committee, put together an agreement that embodies most of these kinds of thoughts. So it's pretty clear that you can get agreement across the political divide on these tough issues when you work together and point out whose side are you on, because right now the consumers and small businesses in America, as my colleague is pointing out, are getting the short end of the stick, and I appreciate that. All right, let's see. Do we have any? Okay, no Republicans. Dr. Shambaugh, just one question. It's been a long morning, and I appreciate both of you and your patience. Apropos of this whole issue of what you will be doing in the future, if confirmed, you'll be working at the G7, the G20, the International Monetary Fund. My wife always says, what are all these initials? But the point is they're key economic institutions with respect to how Americans are going to get affected. And I wanted to ask your thoughts apropos of isolating Russia and ways in which we can get additional sanctions against Russia without any additional pressure on the hit that American consumers are already taking at the gas pump. I mean, we've got to get relief for them. We've been working on our big oil tax fairness bill, which essentially gets at, the question of, hey, why are we, in effect, giving breaks for stock buybacks rather than giving breaks for the mom who is trying to afford gas at the pump, take her kid to childcare? So tell us how you would approach this question of isolating Russia with respect to sanctions without getting even a bigger hit for Americans who are getting clobbered at the gas pump. Your thoughts?
Thank you, Mr. Chairman. I think the general policy that I've heard expressed coming from both Treasury and the White House on this issue has been the goal is always and everywhere to inflict the most amount of damage on the Russian economy in response to this terrible invasion as possible, and at the same time minimize the damage to the rest of the world and to the United States in terms of economic fallout. I know a number of steps have been taken already. Many more continue to be investigated in terms of how to limit Russia's revenue, in particular from energy exports, while at the same time not disrupting energy markets any more than is necessary. So I think there is constant work that can be done updating those things, as well as trying to limit what Russia can buy with that revenue. And I think that has been crucial as well, is that if they can't buy the parts they need for their war machine, even if they are selling oil abroad, that limits what they can do. And so I think there's a great deal of work that is constantly being updated, because these are things that are complicated processes to engage in. But it's work that I would certainly be seriously engaged in, and obviously in contact with the committee if I were confirmed.
Thank you. One last question. You have spent a lot of time looking at the issues of currency manipulation. And currency manipulation has long been of interest to members of this committee, both Democrats and Republicans, because currency manipulation abroad, in effect, almost acts like a subsidy, providing a country's homegrown producers with an unfair advantage over American workers and American businesses, which also, in my state, which depends deeply on exports, about 1 out of 3 jobs in Oregon revolve around trade. The trade jobs pay better than do the non-trade jobs. We don't want to have a policy with respect to currency that tilts the playing field against U.S. Exports. Now, Treasury works bilaterally with countries to resolve currency manipulation issues once they've been identified in your report. So this looks to me like an area that might be beefed up, but we've got Indo-Pacific issues, obviously, the American Partnership for Economic Prosperity, the traditional forums, I just rattled off some of them, What are your thoughts about strengthening the rules to protect American small businesses and consumers against currency manipulation?
Thank you, Senator. When it comes to currency manipulation, Congress has been very explicit in terms of what the rules are that Treasury should use in terms of defining a country that is a currency manipulator. And personally, I actually think it's very helpful that those rules are explicit and not too abstract, because it makes it clear it's not a political decision by Treasury. It's they're following a set of rules that Congress has given us. And if I were confirmed, I would take those rules very seriously. But to your point about bilateral consultations as well as some of the global forums, I think whether a country is in any 6 months period labeled a manipulator or not, that doesn't mean that Treasury doesn't still have a lot of work to do engaging with those countries around their currency policies. It's something that I would expect would occupy a great deal of my time, to be working with colleagues in other countries to make sure that their currency policies are not in any way going against commitments that most G7 and certainly G20 countries have made, and really all countries that are a member of the IMF have made, in terms of not using their currency in a way to gain an unfair trade advantage. It's something I would take very seriously.
Okay, it's been a long morning. Thank you both. We've had a lot of questions posed to both of you. Let me also say to colleagues, not only do I support these two nominees because I think they're very well qualified for the information as senators. Questions for the record are due at 5 p.m. this Friday, July 15th. And I thank you all. It's been a long morning, lots of questions. And with that, the Finance Committee is adjourned.